Comparative Efficacy of Hypnotherapy. Hello everyone, and welcome back. In our last lecture, we explored the broader evidence base for hypnotherapy, the meta-analyses showing strong effects for PTSD, anxiety, depression, pain, and psychosomatic conditions. Today we're going to wrap up this chapter by asking a crucial question. How does hypnotherapy compare to other established treatments? This is what we call comparative efficacy. It's one thing to say hypnotherapy works, but how well does it work compared to other therapies or medications? Psychological versus pharmacological treatments. One of the earliest and most influential comparisons was made by Etten and Taylor in 1998. They reviewed a range of treatments for PTSD, including both psychological therapies and pharmacotherapies. Here's what they found. Psychological treatments, like behavior therapy, EMDR, and hypnotherapy, were consistently more effective than pharmacological treatments such as SSRIs. Dropout rates were also lower for psychological treatments, around 14%, compared to 32% for pharmacological ones. This finding is significant because it shows that hypnosis belongs in the same conversation as other first-line psychological interventions, not on the margins. Nexhmedin et al. 2021. Large-scale evidence. A more recent meta-analysis in 2021, conducted by Nexhmedin and colleagues, examined 136 randomized controlled trials of hypnotherapy. The results were clear. Hypnosis produced large effects across multiple conditions. Interestingly, the quality of the studies did not significantly influence the outcomes, meaning the positive results weren't just due to weak study designs. This strengthens the case that hypnosis is a robust therapeutic tool, not a placebo or a passing fad. Why patients stay in hypnotherapy? Another area where hypnosis shows an advantage is patient retention. High dropout rates are a serious problem in trauma therapy, especially with approaches like prolonged exposure. Hypnosis, however, often shows better engagement and lower dropout rates. Why? Likely because it feels less confrontational than exposure therapy. It can produce calming and empowering effects early on, which builds trust. It offers rapid symptom relief for insomnia, nightmares, or pain, which makes clients more motivated to continue. 4 clinical uses of hypnosis in psychotherapy. Finally, let's highlight the 4 main ways hypnosis can be integrated into psychotherapy. Symptom relief. Hypnosis can rapidly reduce distressing symptoms like anxiety, pain, or insomnia, making it easier for clients to engage in therapy. Mobilizing personal resources. Hypnosis helps clients access their own resilience, imagination, and strengths, resources they might not realize they have. Teaching skills. Through hypnotic rehearsal, clients can practice cognitive, behavioral, relational, or emotional skills in a vivid, experiential way, creating new associations or dissociations. Hypnosis can help reframe traumatic memories, separating them from overwhelming emotions or linking them with new, more adaptive meanings. These 4 uses make hypnosis versatile. It can be tailored to different needs and seamlessly integrated with therapies like CBT, CPT, or EMDR. Pulling it together. So, where does this leave us? Hypnosis compares favorably to medication for trauma-related conditions and often enhances the effects of traditional psychotherapy. Dropout rates are lower, suggesting it's more engaging for many clients. Large-scale evidence confirms hypnosis produces real, reliable, and lasting effects. And in psychotherapy, hypnosis can be used flexibly for relief, resource building, skill learning, or reframing trauma. Key takeaways. To summarize, Etten and Taylor, 1998. Psychological therapies, including hypnotherapy, outperform pharmacological treatments for PTSD with lower dropout rates. Nexhmedin et al. 2021. Large-scale meta-analysis confirms hypnosis has large effects across conditions. Hypnosis supports retention by producing early benefits and reducing therapy avoidance. Hypnotherapy serves 4 major roles in psychotherapy: symptom relief, resource mobilization, skill teaching, and creating new associations. This concludes our series on hypnotherapy and trauma treatment. We began by asking, what is hypnotherapy? And ended by showing not only how it works, but also that it stands as a powerful, evidence-based tool that deserves a place in modern trauma therapy.